resource to be able to deliver children
Yes.
in those critical areas. But there is also a lack of doctors who would be able to perform C-sections. How can we help the country, Dr. Samaan, address those lack of resources?
I think our main priority as specialists is to train and educate from the patient, from the nursing staff, from the midwives. I saw also a lot of malnutrition.
Yes, sir.
And as simple as folic acid, which is vitamin B9, it's minimum. We need 1,000 microgram, which is 1 milligram a day, to prevent neurotubal defect like spina bifida and anencephaly.
Dr. ADEL, my role as your host is to try to interpret it in a language which our provincial audience on Global News Network can understand. If you were to translate that B9 component as a vitamin supplement, what kind of natural foods would have that vitamin element?
Usually you find it in cereals, you find it in green leafy vegetables.
Okay.
Lettuce, spinach, bok choy.
Bok choy, here it's lettuce or pechay. Yeah.
Okay, that too. And also I saw very bad malnutrition in the mother pregnant. I saw early teenager pregnancy as early as 15 and 16. And they have very bad malnutrition, and the consequences of that, you may have IUGR, intrauterine growth retardation. You have low birth weight of the infant at delivery, and these children, they don't do well in school. Especially in the first year, they don't have a high IQ.
Well, for those expectant mothers out there, maybe you can help yourselves by really eating well, okay? Nutritious green and leafy vegetables, a lot of cereals, as Dr. ADEL said, because it's very critical for you to have normal birth and minimal defects on your infant or your babies so that they don't become malnourished when they are growing inside your womb and when they are already out and have been birthed.
And this is the duty of the nurse or the midwife who does prenatal care to explain and educate the patient on how to eat, how important is nutrition, and how important is to follow the clinic and follow the appointment to prevent many complications in pregnancy. I saw also a lot of prenatal deficiencies. I saw prenatal premature labor due to simple thing as cystitis, inflammation of the urinary bladder, or UTI, urinary tract infection. Something very simple like that, and it could be prevented with better care and
education. Knowledge. Well, ladies and gentlemen, I'm Deanne Hernandez. You're watching Business Portal Pinoy Matters. We'll be back in a minute to continue on the advice of an expert OB/GYN surgeon from Los Angeles to help our Filipino mothers, their families, their caregivers, the midwives, on how they can do little things by themselves while they're carrying the children and when they have given birth to our Filipino infants who are our future generations. I will see you in a minute.
And I saw in many in clinics here that many women have they never even had a pap smear.
Never had a prenatal. Some I know in the mountains or remote villages, they don't get to see a doctor.
They don't get to see a doctor. And also about HPV, human papilloma virus, which can cause cancer of the cervix.
Cervix,
We
yes.
saw quite a few cases of these patients that you are right, they never seen a doctor, they never had a pap smear. And you know, HPV, especially there are so many subtypes of human papilloma virus.
Yes, sir.
The most important is 16, 18, 70% of cancer of the cervix is caused by subtypes of HPV 16, 18.
How does a woman contract cervical cancer, the HPV virus? How is that?
Sexually intercourse without any method of protection.
By protection, we share with our GNN what OB/GYN would recommend as a very safe protection for the woman and for the man as well?
The use of condoms, that's very, very important. And number one. Number two, you limit your sexual partner to one.
Just to one. Okay,
Yeah.
so you promote faithfulness and a monogamous relationship.
Absolutely.
Yeah, but Dr. Adele, you know that we have 7,100 islands, and maybe not all of them have drugstores where they can get those condoms, okay? What other ways can a woman protect? Can she wash with what we call guava leaves, which is our natural antiseptic? I mean, are there other ways for a couple to protect themselves and have safe sex without condoms?
Unfortunately not. I mean, the virus, once you have a contact with a partner, you can carry that virus, and it stays in the cervix, in the squamous columnar junction, and that's the area that later go to cancer.
I see.
Therefore, we need to do pap smear. Pap smear is just a screening, and if there is any abnormality in the pap smear, we do colposcopy, cervical biopsy, and the cervical curating, and we can freeze the cervix and cure the pre-malignant lesions before it will go to cancer. That is very, very important. Another aspect I saw a lot of chlamydia and mycoplasma.
Can you please share with our audience what is chlamydia or chlamydia or what? Yeah?
Chlamydia and mycoplasma are infections caused by a bacteria, and it's also sexual transmitted diseases. However, like gonorrhea, GC can give you symptoms like after 3 days, urethritis, vaginal discharge, and burning. However,
sensation during urination.
Sensation.
Yes.
Chlamydia is very insidious. Chlamydia, a woman can have chlamydia and don't have any symptoms.
And not know it.
And
then when does it manifest? When she gives birth or gets pregnant?
No, it can manifest into in many forms. Number one, she can have pelvic pain. Number two,
pelvic pain
yes,
is a sign that something might be not right. Okay?
Absolutely, and also she can have tubal pregnancy because she has scarring of the tubes, fallopian tubes, caused by the chlamydia.
So the baby grows inside the fallopian tube, not in the uterus.
Not in the uterus. That can rupture. And also, she may have severe scarring of the tube, and that's what we do, tuboplasty, to repair the tube caused by chlamydia. And I've been seeing this in my private practice in Westwood, in Los Angeles, that there is a lot of patients, a lot of students have chlamydia, and they don't even recognize.
Because the young generation call it hormones, but they start very young having relationships.
Relationships.
No? And multiple partners
Multiple
at that.
partners. Therefore, we should do, when we do the pap smear, we have to do gonorrhea culture, chlamydia culture, mycoplasma culture, and it's cost effective. I mean, even if in 100 patients you screen, even if you catch 3 or 5 patients and you save those patients,
that's already an advancement for us, okay, in our efforts.
Absolutely.
To check. Well, let's go to something more positive, because you know, The Philippines has a very strong population birth rate, but how can we help our viewers and guests take better care of the moms to be by their families and friends through your advice?
I think if a couple planning to get pregnant, I recommend that they see their specialist early and have all the tests early and have all the diet and prenatal vitamins early and have regular checkups. You see, the main problem is not here in Metro Manila. In Metro Manila, many big hospitals, big doctors.
Have the services available, yes.
My main problem is in the provinces and the barangay. I saw so many things that I just could not believe. And there is no support, there is no doctors available. And I remember about 3-4 years ago when I had a meeting with Senator Butch Aquino, and I was telling him about this problem, the lack of doctors and specialists in the barangays.
Level, yes.
Level. I proposed to him, I said, I can have this proposal in the Senate and see if we could mandate it. I told him that any doctor after medical school, they have to spend 1 year or 6 months
community service.
Community services in all the barangay. And I think as physicians, we have the duty to serve our poor patients,
Yes.
our in need. And at the same time, those doctors, when they do the service, they learn. They
Exactly, the experience.
The
Actually,
exposure.
Dr. Samaan, maybe with what you planted a seed then, now we don't allow our nurses to leave unless they render 3 years of experience locally and have community service. It is now a requirement before you are allowed to go abroad to look for greener pastures and maybe bigger salaries. You have to spend 3 years of getting experience here serving the country. So it's being done now.
Okay, so I hope at the level of doctors in medical school, they can implement that and do that for doctors before graduation or before getting their license, that they spend some time to serve the community.
But Dr. ADEL, we have a current situation. As I said earlier in the program, we have about 22,000 midwives needed in different parts of our 7,107 islands. But we have 180,000 nurses, of which only 70,000 can be accommodated in the provincial hospitals and other clinics to get their practicum and residency or internship, so to speak. Can you please advise our country, since this is Pinoy Matters, what do we do with the other 120,000 nursing graduates who can probably help fill the 22,000 gap needed for midwifery? What does it take for them to be able to transition and become a resource for assisting our Filipino mothers in giving birth?
I think we have to have some kind of incentive, a better, maybe better salary, better promotion, and we have to make them aware that the country needs them. The country needs
badly
everybody,
needed.
badly needed. And I myself, you know, whenever I come here, you know, I'm more than happy to train nurses, train midwives, train young doctors, especially again in the provinces where they really, really need you. I mean, I saw things that it's really heartbreaking and brought tears to my eyes. A lady, 50 years old, that she has cancer of the breast, didn't take care of it because of lack of finances and
that's correct.
lack of proper clinic, and the cancer spread to the chest, to the abdominal wall, and that lady cannot, I mean, she's terminal. She's the last stage of cancer, and she'll die. I mean, there is really nothing you can do. You can do some palliative radiation, chemotherapy. to extend her life a little bit. I also saw fetal death in utero. Pregnant patient, young, 18. I saw that in Paon, as a matter of fact. She has, the baby died 2 days, 3 days ago. She came to the clinic to see me, and I want to send